Is a calcium score test worth it? The cost of a calcium score test in the US is around $100 to $400. Adding to that, you have the wait time in the hospital for the test. You also expose yourself to radioactive X-rays. Is all the trouble worth it? Hello everyone, welcome to True Health Explained with Dr. K here. Let's dive right in. Is the calcium score a good indicator of your cardiovascular risk? Does it tell you what's wrong and what issue to tackle? Many of you think the calcium score is a good test to see your plaques, and that's why many of you do it in the first place. The real answer is almost as it doesn't provide the full story. Let me explain. If you signed up to my free newsletter where I send free in-depth videos and tips every day about coronary heart disease and its progression, you already know very well how calcium is formed in your arteries. If not, you're missing lots of important information and the latest research about the development and progression of plaque. Now, this calcium can either be formed on the inside of your artery or on the outside. So if it's formed on the inside, then it will obstruct the flow of blood to your heart, which can lead to dangerous outcomes. However, if it is formed on the outside, then it won't obstruct your blood flow and it won't have any cardiovascular risk unless it ruptures. If you want to know how plaque ruptures in detail and how to reduce your risk of this happening, sign up for my free newsletter to get free in-depth videos and tips every day. Unfortunately, the calcium score CT score test doesn't tell you whether your calcium is on the inside or outside. Doctors cannot know from the CT image scan either. And if it's on the inside, how much blood flow is it obstructing to know the gravity of the situation? We don't know as well through this test. Hence, assessing the immediate cardiovascular risk using a calcium CT is difficult. Even if your calcium is on the outside, it doesn't mean you're risk-free. It means you have atherosclerosis happening. You may have soft plaques as well, and you're still at risk of any plaque rupturing. I explained how in my in-depth videos. Now, let's say someone has a high calcium score. Whether it is inside or outside, it means he has much plaque and needs to start taking action to reduce his future cardiovascular risk. But what actions to take? Reduce calcium intake? Calcifications are a late event in the plaque formation process, as explained in my in-depth videos. Several factors contribute to the calcification of the plaques and the formation of the plaques themselves. That's the problem with the calcium score also. It doesn't tell you where the exact source of the problem lies. Do you have a thyroid issue or genetic issue, or does your lifestyle need changing? So bottom line, calcium score basically tells you whether your plaques are calcified or not. If someone wants to know whether his plaques are calcified or not, calcium CT is the test. However, it doesn't tell you if you have soft plaque or not. If your calcium score is 0, it doesn't mean you don't have plaques at all. It only indicates that you don't have calcified plaques. But you may have soft plaques, which is more dangerous as it is more prone to rupture. Hence, you should not view your 0 calcium score as you don't have plaque, rather as we don't know. Fortunately, there's an emerging technology coming which I'm very excited about, and I'll discuss it in another video. It might replace the calcium score totally. But as of today, what are the tools to evaluate the probability that you have soft plaques? Until now, one of the best ways to assess your cardiovascular risk and the probability of having many or little soft plaque in a non-invasive way is a good detailed blood test. If you want to know what to look for in your blood test, click on the link in the description below to get a PDF of all the details. Through your blood work, we'll have a good estimation of how much plaque you might have, and your associated risk will simultaneously know which metric to work on to reduce your cardiovascular risk. It is a very good screening and preventive test. Regarding knowing exactly if you have plaque that is obstructing an artery, the best technique remains the coronary angiography. This technique allows you to know and visualize the exact location where there's a narrowing of your blood vessel. However, this is an invasive technique, requiring local anesthesia. As it is an invasive technique, it exposes the patient to other risks like infections and vascular risks such as hematoma, embolism, heart rhythm, and renal complications with patients who have renal issues. Cardiac surgeons, of course, take all necessary precautions to avoid those risks, but the risk is never 0. That's why this test is only performed under certain conditions. For example, if we detected an abnormality relating to the arteries on the ECG. Depending on your situation, your cardiologist will see if a coronary angiography is required. So, bottom line, if you want to assess your risk of cardiovascular disease and to know your situation, a detailed blood test is the starting line. If your doctor knows how to interpret your blood results, he can tell if you have soft plaques or not. If you want to learn how to interpret your own blood work, sign up for my free newsletter below to get daily information about understanding your heart disease. Regarding coronary angiography, please consult with your doctor, as it is not a simple, direct decision. If you like this video, hit the subscribe and like button for more and share with a friend.